We looked at the fact that we're aiming for the top, we're aiming for heights. We're not just wanting to be the regular private hospital in Nigeria that then comes in low scale and fizzles out. So Cedar is representative of Cedar of Lebanon, which is a tree of strength, and Crest is the top. This is where we want to be. This is where we have to keep our focus, keep our eyes on the very, very top. And that's why we merged those two names to be Cedarcrest.
I'm happy to be here this afternoon to officially commission the Cedar Crest Hospital for the sake of humanity. Thank you for the cooperation.
Cedar Crest Hospitals, a world-class health facility that provides quality medical care to meet the needs of both local and international patients within Nigeria and across the globe. Between June 2022 and June 2023, Nigerians spent approximately 8.3 billion naira on foreign healthcare-related services, according to figures released by the Central Bank of Nigeria. This trend is mainly due to the lack of trust in Nigeria's healthcare system by affluent Nigerians who prefer to seek medical treatment overseas. Investing the money spent on medical tourism in Nigeria's healthcare sector will bring substantial benefits to the country. This will make Nigeria an attractive destination for medical tourism, eliminating the need for Nigerians to travel abroad for quality healthcare services. Given the necessary enabling environment, medical professionals have a responsibility to play their part in providing high-quality medical care in Nigeria. Cedar Crest Hospitals is a Nigerian corporate citizen established based on a strong sense of patriotism and the ethics of the medical profession.
Shortly after I returned from the UK in 2006, I did come back with the feeling that we needed a place for proper orthopedic practice to be able to serve Nigerians such that they will be able to get the kind of service that we're used to abroad. And like you know, people who have orthopedic problems at that time really were challenged by the number of options that they had locally. So this was really the inspiration, first of all, to start up orthopedic practice. And then, of course, eventually we thought that the need was actually more than orthopedics by itself. So we're inspired by this need and by the conditions we saw in people around us who needed care. And we knew that if we had the right facilities, we would be able to offer this care. So this was what pushed us on.
The hospital is managed by a board of directors who are professionals in their own right. Cedar Crest Hospitals Limited, a private multi-specialty hospital group with its headquarters in Gudu, Abuja. The hospital was established in 2008 with a vision to provide patient-centric, proactive and reactive healthcare with excellence in quality, service, and access in all major cities of Nigeria and beyond. The hospital is guided with a mission of enhancing lives through quality healthcare and the following core values in the discharge of its services: quality, competence, integrity, patient-centered care, and speed. Cedar Crest Hospitals is dedicated to providing its patients with top-notch medical care, and this commitment is backed by highly qualified specialists from around the world. Currently, the hospital group operates 5 hospitals across Nigeria: Gudu, Abuja; Gwarimpa, Abuja; Victoria Island, Lagos; Kainji, Niger State; and Jebba, also in Niger State. With over 45 in-house consultants and more than 40 local and foreign visiting consultants specializing in various medical fields, the hospital group is well equipped to cater to the needs of its patients.
Hospital business or going into healthcare is actually something that one doesn't do alone, so we do work with a lot of international partners in terms of people and institutions. We have specialists who come here to work from all over the world, and they are the ones that actually are the bedrock of the kind of specialist practice that we give. The partner institutions, we do work with a lot of them. We work with institutions in Germany, in the US, and in the UK mainly.
When I came to Nigeria then, I found similarities between myself and the people who founded Cedar Crest. They were hell-bent on establishing good ethics as well. So that was something we had in common. So it was easy for us to start working together. Good people build good hospitals. So it wasn't surprising when they started getting good outcomes, because when you do things properly, you get good outcomes. In the same spirit, they were inviting people from all over the world. So it was a place to have people from different health, economy, cultures coming together to try and build this thing in Africa, in Nigeria, that is bespoke for Nigeria. So you may say that we were trying to replicate what happens in places like America or the UK. We're only trying to replicate the good things that they do. We're also trying to adapt it for our local circumstances. Because of this similarity and commonality of ideas between myself and the ladies and gentlemen who founded Cedar Crest, it meant that our association blossomed and got better and better and better over the years.
To give results to your patient, it's not only you who can give, but you require a good team and a good support, which I always get at the Cedarcrest Hospital, whether I need very high quality implants, equipment, and all my needs are fulfilled for the best patient care. So that's so far my experience with the Cedarcrest is very good in giving good results to my patients and getting all support from the hospital. So that's drive me forward to work with them.
We treat a lot of complicated cases in Cedarcrest. Infected non-union, osteomyelitis, very complicated fracture, foot deformities, congenital anomalies. We did more than, in my specialty, I did more than 500 cases, and thank God the success rate was more than 96%.
In total, Cedar Crest Hospitals employs over 700 staff members who support approximately 150,000 registered patients.
In the last 15 years of our existence since 2008, we've actually made a lot of progress. And we did see the need early. We knew that we needed some better facilities to be able to give the kind of care we wanted to give to patients. And therefore, we started planning to move the hospital to the present location in Gudu. We put efforts to start this 80-bed hospital here, and we eventually completed that. Apart from our progress in Abuja, we also made progress in other parts of the country. We established the Lagos Hospital in 2012, and that has also grown. First we were on the mainland, and then we moved to the island in 2015. And then in the last 2 years, we have started also creating a multi-floor 60-bed specialist hospital in Lagos, which is going to be completed at the end of this year. That is already 90% done.
So it gives me great pleasure to make a few remarks and welcome us at the formal groundbreaking ceremony of the new Cedar Crest Hospitals, Lagos.
We established 3 hospitals in 2020. One we established was the hospital in Gwarimpa here in Abuja, which is a 10-bed hospital. Initially started as a COVID testing center, and that has now metamorphosed to a hospital. We also took over the running of 2 industrial hospitals in Niger State. These hospitals belong to the body called MESL, the Mainstream Energy Solutions Limited, and they contracted us to run these hospitals. They are each 40 beds in Kainji and Jeba. And we've run these hospitals from May 2020 up to date.
Cedar Crest Hospitals has over the years expanded to many specialties and services, including emergency medicine, family medicine, specialty medicine, intensive care, pediatrics, obstetrics and gynecology, orthopedics, neurosurgery, vascular surgery, general surgery, and other surgical specialties. There is also interventional radiology, diagnostic radiology, prosthetics and orthotics, physiotherapy, and the laboratory.
In the past 5 years, we have introduced more services and we have expanded into other clinical space which we didn't used to do before. Now, some of those services notably include the introduction of a cardiac catheterization laboratory. Okay, that's big for us because in the FCT, there are about 3, not more than 4 functional cardiac catheterization labs, and we pride ourselves with having one of the best catheterization labs in the FCT. Our services expand up to the north, where you do not have this service readily available. We have also ventured into dialysis, renal dialysis. We understand that the burden of patients who suffer from renal pathologies have increased over time, and the specialty, the experience, the capacity to provide quality health care for this group of people is not widespread. So we have patients who within our facility once in a while need to have this dialysis, and we thought it wise to establish a dialysis unit.
I also must mention that we have the pediatric unit, and that pediatric unit, we have NICU. You've heard about intensive care units for adults. This is for babies. So if we have children who are ill, we can look after them right from pregnancy to delivery, so when they grow up to adults and even to old age.
We can boast of state-of-the-art equipment here at Cedarcrest Prosthetic Center. It's important to mention that the center was set up in collaboration with Ottobock, Germany, and that's again where many of our specialists trained in order to be able to render these services to the Nigerian people and many across Africa. We are very supportive, I would say, to many other healthcare providers, most especially the orthopedic surgeons. Many of them had patients with complicated situations leading to amputation. And when this happens, these individuals would usually require to get back to the society. So we fabricate for them prostheses with which they are able to walk again on their 2 legs and not needing to use crutches. So we fitted patients with hip disarticulation, we fitted patients with above knee amputation, we fitted patients with below knee amputation, ankle, partial foot, and then we've had people with upper limb amputation.
If you look at our Ottobock map of Africa, besides our official Ottobock centers, Cedar Crest is on our Ottobock map. It is the center, the Cedar Crest Prosthetic Center is the center that gives us representation in West Africa. And we are happy and privileged that we have such a partner that has been helping us assist people regain their mobility in this region. Thank you so much.
Many Nigerians have enjoyed the services of Cedar Crest hospitals and have credible stories to tell.
I started using Cedar Crest in 2013, and I went in there with something to do with my knees, and I've been able to do 2 knee replacement surgeries. I did my first knee in January, my second knee in March, got physiotherapy services, and here I am, you know, walking up and down like a 20-year-old. You know, my knees are in top form. And it's not just my knees. Everything you really need in terms of services, they look after you. And, you know, I say to people that there's really no need to go abroad for these services because you actually get the very best from Cedar Crest. When you go in, it's like you're in a hospital abroad. You know, they've got all the technology, you know, and you experience that. You experience the very best in terms of medical treatment. They've got great doctors and they've taken good care of me. So it's very convenient and it's also very affordable.
Despite these achievements, Cedarcrest Hospital is looking into the future, both with optimism and with plans for better services.
We're in partnership with the United States Trade and Development Agency for the development of the Cedar Crest Comprehensive Cancer Center, which is going to be the first truly comprehensive cancer center in West Africa, because it's going to provide all areas of cancer care.
The body of oncology is increasing in Nigeria, and that's why we are deciding that we must open a center where our patients do no longer have to go abroad to go get those services. We provide it here, which means we will reverse tourism.
We hope that in the coming years we're going to mature or metamorphose into a point where we'll be offering renal transplant for patients who need that renal transplant services. We also hope in the future we're going to have in vitro fertilization set up and fully functioning within the hospital, as well as introducing plasma apheresis, okay, for our patients who require the various forms of blood and blood products for their care.
Cedarcrest Hospitals is contributing to the improvement of health outcomes and reducing foreign medical tourism. It also facilitates knowledge transfer from experienced practitioners to upcoming medical professionals.
Training is part of is at the forefront of our thinking at Cedar Crest. We even established our own training school called Cedar Crest Academics, and the whole purpose is to make sure that when people join us, irrespective of what they've done before they join us, we can train them to the level, well, close to the level at which we want to be able to compare them to their international counterparts. It is no coincidence that a lot of the doctors and nurses that go overseas would like to come to Cedar Crest because they want to have it in their CV, because it just gives you a better standing when you go to other countries.
A hospital that's trying very hard to develop a service that has quality and also is bringing its staff forward, is training its staff, because if you have well-trained staff, then you can supply a quality service. I've been here twice now. The first one was predominantly training with the registrars, the junior doctors who are learning our trade of emergency medicine. This time round it's been more spreading that training out to the nursing staff.
I was a resuscitation training officer, so I did lots of training within the UK, teaching people how to do everything from basic life support to advanced life support. So I was asked to come and help do some of that training at Cedar Crest and help the staff here develop their own system and their own training so that they can become better clinicians. The staff are really keen to engage. As you can tell, my voice is going a little bit, and that's because they've been asking for more and more training. So I've been doing courses every day, and more courses than we're expecting, because people are very, very keen. Obviously things are a lot different to the UK here, training is different, but actually being able to be part of that and actually start moving the training on is very, very good and very rewarding for me.
We are planning to expand our training. We have just been approved by the Nigerian Orthopedic Association as one of the first centers to offer post-residency fellowship training in orthopedic surgery, in specifically arthroplasty and in pediatric orthopedics. That's going to start in 2024. So we've got a lot of plans. We're also planning a lot in family medicine, where we want to set up a residency training program, and we also want to start some wellness clinics. So we're just not looking at specialist care, we're looking at preventive care as well, because right now we offer the entire spectrum of care.
No doubt, Cedar Crest will continue to expand its services across Nigeria and beyond.
15 years is big for us, and looking back, we have achieved a lot in these 15 years. This achievement cannot be accredited to one man or one woman alone. This achievement is accredited to every single person who has worked in Cedar Crest, who has contributed.
The things that have made Cedar Crest what it is, dedication, tenacity, never say die attitude, and integrity. We have managed to provide a platform for medical workers to be able to practice their craft in an effective and efficient manner to produce the best outcomes. At 15 years, I want to say a very happy anniversary to all of us in the Cedar Crest family.
Our planning in the next 15 years is to do more and more in Cedar Crest and serve more and more patients from all over the country. Happy 15th anniversary, Cedar Crest.
A massive congratulations is in order. A massive pat on the back is in order. A massive glass of champagne will also be in order.
It's 15 years since this hospital started, and they've made this progress so far. Another 15 years and you'll probably be leading the whole of Nigeria. And good luck to you.
I know staff that work with us in the UK from Nigeria. I told them I was going to Cedar Crest, and they're like, wow, that's a good hospital. So your reputation follows you, and keep that up, keep the training, keep getting better, and keep achieving what you are doing.
Many congratulations to Cedar Crest Hospitals and Dr. Felix and his team for moving on and forward. They've done incredible work on the west coast of Africa, contributing to development of orthopedics and trauma. I hope it goes to further success for benefit of patients and the community in general.
We want to wish Cedar Crest a happy 15th anniversary. It's been a journey, you know. We've been with Cedar Crest, partnered with them, and provided quality care to enrollees. And we're so happy on this milestone from Cedar Crest.
I want to wish you very, very happy anniversary. I hope you celebrate because it is well deserved. It's been just delightful to see how Cedar Crest has been developing year after year.
My best wishes and congratulations from Koblenz Catholic Clinics for your 15th anniversary. I admire and value your hard work for all patients in the last 15 years. We are grateful for our great partnership for polio patients, and I look forward to work with you in the upcoming years.
I want to congratulate Cedar Crest Hospitals for coming this far and celebrating the 15th year anniversary. We have come a long way together in our relationship between Cedar Crest Hospitals and Grandeur Technoserve Limited. We recall having to design and build the Gudu Hospital, even within available limited financial resources. That has become our star project in hospital design and construction. We congratulate you, Cedar Crest. We wish you all the best in years to come, and we look forward to continuous and better working relationship between your hospital and Grandeur Technoserve Limited.
One of the things I commend your team for, and in fact I'm grateful to God for, is your undivided focus on patient care and well-being. I have the privilege of sitting on the board and spending hours listening to analysis and discussing reports on clinical governance, which testify to your commitment to continuously improve the quality of service and ensure better patient care and safety. I have no doubt in my mind that with this kind of commitment and other qualities that I've seen in Cedarcrest, that you will even grow much more than you have grown in the 15 years.
I believe we'll continue to do this as a team, and our aims, our objectives, and the entire goal of Cedar Crest will be met if we continue to work together.
Cedar Crest staff, Cedar Crest family, Cedar Crest founding members, well-wishers and naysayer, I say congrats and a big well done. We're excited. Join us on this journey as we celebrate our 15-year anniversary and as we move forward towards greater heights. The sky is not even our limit because we'll go beyond. Look out for us, we're coming.